Hi guys, Keith Sparks here, and today for Foam Rolling Friday we're going to talk about a group of muscles known as the hip flexors. Now the dominant muscle that people think of when talking about the hip flexors is the psoas muscle. It's a great muscle, it's a powerful muscle, but it actually acts more as a lumbopelvic stabilizer than a true hip flexors. It's just not in the best advantageous position to generate hip flexion. And what I mean by hip flexion is whenever the leg comes up in this position. It's required a lot for athletic sports. So today, we're gonna show you some foam rolling tips in general for the hip flexors, but a dominant hip flexor known as the rectus femoris. It starts above the hip on the pelvis and goes down and actually attaches to the knee. When you hear of patellar tracking problems, it's oftentimes issues with the rectus femoris. So we're gonna show you those videos now. So it's really simple, don't overthink this. All I want you to do is whatever foam roller you have, put it right in the crease of your hip. So if you bring your knee up towards your face, right in that crease is where I want you to set the foam roller. From here, and I'm gonna actually turn and show you from the front. I want the edge of the foam roller towards that side that you're gonna foam roll. I don't want it in the middle. You just won't get the pressure that you're looking for. So a little bit to the side, bring the other knee up. So that way you can use the knee and the foot to push forward and backwards on, okay? From here, I want you to foam roll in that area and find a really good spot. For me, it's a little bit higher than where the hip is at. What I'm gonna do from here is I'm gonna squeeze my glutes, and you can't see this, but I'm squeezing my glutes and I'm driving it down into the foam roller. And this will work on getting some of those muscles. Now, a lot of the hip flexor muscles actually are very long. They cross the hip over a broad distance. One is that rectus femoris. So I'm gonna turn to the side. What I want you to do now, same concept, is get down into the thigh, find a good spot, and from here, same thing. I want you to squeeze the glute and drive the leg down into the floor. If you don't feel much tension with this, what I want you to do is drive it down, find that good spot, and now bring the foot up towards the butt. And you will feel increased tension this way. And what we're doing is we're really working on that rectus femoris muscle that crosses both the hip and the knee. And if you look at the blog that's with this video, you'll see the referral pattern from this group of muscle. Now the other one that really acts up, especially with a lot of runners, is called your TFL. It's a little tiny muscle that also starts up at the top of the pelvis and goes down and crosses the hip. You can do the same concept. Lay on the front, slightly lean into it, and drive down. And then bring up the knee and back down. Give these foam rolling tips a shot and let us know what you think. Thanks.